All right, guys, let's chat about cannabis and seizures. So that is quite possibly one of the very first disorders that we started recognizing where cannabis was very effective, okay? And so what is happening there is that your body is responding to not just THC, which is the psychoactive component, but our body is also responding to CBD, which is largely known as the biological component, okay? CBD is very good to reduce tremors, muscle spasticity, anxiety as well. And so when used in combination to THC, that CBD is the one that is really driving the reduction of seizures. So I'm not sure if you guys have heard of something like Charlotte's Web, but it was one of the very first CBD companies that was able to show us where this high CBD product was reducing seizures in pediatrics. And so some of these children were going from having 100 to 200 seizures a day, if not more, down to less than 5 a week and eventually none in almost a year. So what we know now is that cannabis in the form of CBD more particularly is the most involved molecule from the plant that is accessing the correct receptors in the body to help in turn reduce those seizure disorders for patients. And so if you're wondering about if cannabis would be very effective for you with a seizure disorder, whether it be grand mal seizures, which are tonic-clonic muscle movement, or it would be what we would consider petit mal seizures, which are more of like a focal seizure and staring. Cannabis can help with either one of those categorically. So keep that in mind and don't be so afraid as cannabis as an option and a last resort. Let's start looking at what it can do positively for the body and ask. Call us and ask. Here at Kaya Life, we'll be more than happy to help you if you have a seizure disorder.